inviting me here. Thank you, Nazneen man, for the introduction. I will just share my. Is this visible?
No, yes, ma'am, it's visible. You can just put it in
slideshow mode. Yeah, perfect.
Is this, yeah?
Prajakta, right. Belated happy birthday. And it's nice
Thank
to
you
see that
much.
today you're sitting, because last session, I know with your commitment and passion, you were on the road, you had stopped and you were doing your session. That talks a lot about your passion and commitment. So
thank you very much, Cheryl. Thank you. I've been given a topic on exercise and diabetes, and let me tell you, exercise is a very, very vast topic. I have tried to stick to being very, very practical in terms of an educator approach. So let's start with it. But before I go ahead, there are a lot of questions when people talk about exercise. We have a lot of issues in terms of understanding the concept, physical activity, exercise, and physical fitness. So it is three terms are absolutely interchangeable, but the differences are in the actual definitions of these three, and we as educators should know what to use when. Now, physical activity, I'm sitting in front of you, and if I just sit and stand up, or if I move my hand, it is a physical activity because it is causing some kind of a skeletal muscle movement leading to energy expenditure. But exercise is a subset of this physical activity, which we should remember. One is planned, second it is structured, and third is a repetitive form to gain or achieve a particular goal. So the goal could be anything. In this case, we are talking about a good glycemic control, a weight loss, a fat loss. And what is physical fitness? It is the attributes that are either health or skill related. So we have to be very particular when we talk about exercise to our individuals with diabetes sitting across our table. And we've studied this, okay? We know that there are 5 elements to physical fitness. We talk about cardiorespiratory, we talk about muscular strength, endurance, flexibility, and body composition. The concepts of body composition have changed right from where I started. It was about weight loss. Now we talk about fat loss, we talk about muscle gain, and we talk about more of resilience in terms of our fitness. So everybody knows this, okay? Diabetes management has 5 aspects. So one of them is definitely exercise. So I'm going to talk, again, I'm saying very practical. I'm not getting into technical, theoretical, but yes, some studies which I came across, which I think I should share with you all. One of the articles I just came across, it's just an article. It's a collection of a lot of topics that the Harvard Medical School went through. And on the 2nd of August, 2023, they published this on their website. They stated that exercise lowered HbA1c values of by 0.7%, even though people did not lose any weight. All right. All the forms of exercise, be it aerobic, resistance, or doing both in combination, were equally good at lowering the HbA1c levels in people with diabetes. Now, resistance training and aerobic both helped in lowering the insulin resistance, which we all know that in diabetes is a very crucial thing about insulin resistance. And it has helped to reduce abdominal obesity, people with risk at diabetes. And they say that instead of only doing one, either only doing aerobic or only doing resistance training, combining both the types gives much more benefits than the individual one. This is something that I really was impressed with. They stated that people who walked 2 hours a week were less likely to die with a heart disease. Of course, because there's some activity is better than no activity. But they also stated that people who exercise 3 to 4 hours a week, it could also be a normal walk, cut down the risk even more. Women with diabetes who spend 4 hours a week doing some form of moderate activity. See, for Indian women, even a walk taking out 30 to 45 minutes is a phenomenal thing, I would say. So even that much amount of walk actually had the of the chances of the developing heart diseases. So it is seen and it has been proven over in time that exercise does help to reduce, or rather, let me put it, gets us a better glycemic control. Again, this is college. We've studied that there are different types of exercises: aerobic, resistance, flexibility, balance. And of lately, this is something called as multi-purpose workouts. So you do a combination of different things, you put yoga in. So they use a good aspect of all three to develop flexibility, balance, and resistance to develop a particular goal in a shorter span of time. So what am I going to do now is I am going to talk about, what I'm going to do is I'm going to talk about each one very quickly and give you all very basic important aspects when we talk about type 1, type 2, and GDM. Now, when you talk about type 1 children, people who've handled children with diabetes, I'm sure Cheryl and Shubda would be, I mean, I've worked with them very closely, and we know that it is very important to understand the insulin doses, the food, the physical activity, and the routine activity. There are parents who are going to start in the beginning the shock of understanding that the child has diabetes versus once the child goes to school and the school routine, which also includes exercise or some form of physical activity, increased activity in the school, needs a lot of planning. We'll need to know what type of exercise is going to affect the sugar levels. And, there's been always a question. Parents are very excited when the child does some activity in school or they go for picnic. They come back and they say that once the child was back home, the sugars were so good, 140, 160. I gave him a big bowl of whatever food he wanted to eat. And that was the end of the story. And in the middle of the night at 2:33, we start getting calls from the same parent frantically that the child is into hypoglycemia. What has happened? So there are concepts that we need as educators to understand that there are sugars that are going to fluctuate during the activity, after the activity, and even very, very important is 24 hours after the bout of exercise that has happened or any form of activity. A lot of studies talk about barriers to exercise, and one of the biggest barrier to exercise is hypoglycemia. So, of course, all of us who are educators here, we know how to prevent an hypoglycemia. When it comes to exercise, we need to understand the blood sugar levels before and starting any activity. Of course, we can't keep doing it regularly, everyday basis. But once you get a pattern, which we call it as pattern management, and when it comes to glucose monitoring, once you understand that, it is easier to plan exercise for anybody. So then second we have to talk about is the intensity. Are you going to be doing aerobic activity? Are you going to be resistance training? Even in aerobic activity, there are different forms. I could be just doing a step class. I could be doing a Zumba class, or I could be doing anything else, which is a combination of, say, some aerobic and some resistance training. So what is the intensity at that particular 1 hour or 45 minutes I'm going to utilize? Again, is it going to be a 30-minute, 45-minute, 1 hour training? And also the modifications of insulin to be done during the exercise. Please understand when it comes to any individual, it's just not type 1. There are different activities. The body responds differently for different individuals. So every activity that you select, we cannot start all activities. Now with children with diabetes, parents will come and tell you, isko cycling bhi karana hai, he wants to go swimming, he wants to play football, I want to put him in cricket. Remember one activity at a time, because if you have to learn the pattern in exercise of how the sugar levels are fluctuating, take one activity, do a pre and a post, do an analysis for over a 10 days period with diet and the other issues. Hello. Am I audible? Sorry.
Yes, you're audible. Perfect.
Sorry, there's some internet connection. Sorry. Also, what we have to do is we have to use a trial and error system when it comes. So there is no thumb rule with type 1 and exercise. So you do a trial,
sorry to interrupt, but what?
And then you.
Prajakta, sorry to interrupt, but you can maybe close your video, switch off your video for better bandwidth.
Oh, sure. I'll do that. 1 second. Is that okay?
Yes, perfect.
Great. So another thing is some activities may need less insulin, may need more carbs. We have to understand as educators and then do it. All right. Another thing that we have to very importantly know is if the blood sugars are lesser than 100, we have to start with a 15 gram of carb and before the exercise, and if possible, monitor it throughout the exercise. If it is 250 and above, please understand 250 and above could be that there could be ketones positive. And if there is ketones positive, we say avoid exercise. High intensity, definitely no. But if the ketones are negative, and you're still feeling well and you would want to do some form of activity, then we suggest some light form of activity, like just walking from one room of your house to another room, like a routine activity, but not anything that is rigorous or any high intensity activity. Now, a lot of parents who are newly diagnosed come up with this one very important issue is spontaneous activity. My child sits at one corner for 3-4 hours, but suddenly will get up and start cycling for the next 2 hours. And it's very difficult to stop a toddler from doing what they want to do. You cannot put restrictions on everything. So what do? It's a simple thing. Any 30-minute activity that a child is doing continuously, support it with a 5 to 15 grams of carb based on the age of the child. So what we suggest is, if the child is cycling or is running around, find a spot where the child is going frequently, stopping and restarting the activity. So wherever they're stopping, put a plate of a snack or put a plate of fruit. So every time the child eats that, they tend to pick it up, put it in the mouth, and then they continue the activity. So at least some form of food that keeps going into their system is going to stop them from dropping their sugar levels. Also, if possible, I know it is very difficult with children and toddlers to keep checking the sugars over and over again. But the reason why we suggest that is because some children are unable to communicate the symptoms follow. So it is best if you can do a pre-exercise or a pre-activity check, sugar check, starting at 150, 160 or 170 diabetic sugar level is much preferred, so that during the activity, they do not go into an hypoglycemia. So as educators, what do we have to tell the parents? First, observe what the child is doing, understand, document it, discuss it with us when they come next, and then we sit and we plan out, if this is the activity, this is what has to be done. These were nice articles that I came across that stated that potential benefits of physical activity and in triglycerides. And the other one also said that there was a significant improvement in A1C in the exercisers with type 1. Coming to type 2, it is much more easier to handle a type 2 because they're usually adults and they understand what we're trying to tell them. Exercise should be the first line of therapy. Habitual exercise is about doing something routinely for a period of time so that there is a high, there is a better control of glycemic sugar, blood glucose levels. Another concept which has recently come in, which I wanted to just talk about briefly, is because there's a lot of research yet to be done, is high intensity interval training. Now, HIT is advisable for people who have very little time to exercise. 20 minutes of HIT, it really helps. But again, a very, very strict precaution or caution when we start HIT is that these individuals have to be young, who've been before being diagnosed with diabetes, and also they need a clearance from their consultant that they can do HIT, because we do not want any other complications with these individuals. BDM, a recent, again, I've just got a March 2023 article, which very well again stated that all women with diabetes who are pregnant are recommended to exercise. It is until unless there is a medical contraindication. And there are some recommendations which are very consistent. Is one, you have to have a screening done from your OPS or your gynac. 30 minutes is advisable 5 days a week, or we say the 30 minutes, split it up. Do 10 minutes after breakfast, after lunch, and after dinner. And it does not mean only exercise. It could just mean walking. Again, I'm saying, rather than sitting idle in front of the TV, it is about walking in and around the area. Again, they say that you can combine moderate intensity with aerobic resistance training. But given the Indian scenario, most of the women do not have or may not have experienced resistance training before pregnancy. So the acceptable form would be walk, because no family members would also object to a lady walking, because there could be a chance that there could be a precious pregnancy in the family, and they would say walk is better than doing any other activities. Of lately, we have these prenatal classes where they do a lot of exercises with dumbbells and with exercise balls. Again, they all have to be supervised if you're doing any kind of moderate to high intensity activity during pregnancy. So coming to quickly recommendations for exercise. Now, this is for people with diabetes, type 1, type 2, gestational. So the thumb rule is 150, okay? AHA says 150 minutes per week of moderate to vigorous intensity activity. It could be split over 3 to 5 days a week. They say that avoid skipping more than 2 days of workout, because it is a routine. Try sticking to 5 days daily. Now, there is, again, as I said, HIT, there are higher vigorous intensity activities which you could do 75 minutes per week. You could split it up on high intensity. But again, it's been very clearly said, it's for good, younger and physically fit individuals. You have to have a screening done before you start any form of activity. Adults with diabetes can do 2 to 3 sessions per week of resistance training. Again, please understand, resistance training, people think it is only about picking up weights or picking up dumbbells or picking up barbells and plates. No, resistance training could be as simple as thing of using your own body weight. A recommendation that we usually give is, if you have no joint aches or you have no other pain, a simple thing like a Surya Namaskar, what we did in school, would also be very helpful when it comes to using your own body weight against your, for helping you do some form of resistance training. With older adults, because these older adults would land up with having some form of joint pains, shoulder pain, frozen shoulder. So it's recommended that you do flexibility training and balance training 2 to 3 times a week. Yoga is said to be a good form of incorporation of some activity because it does all. It does flexibility, muscular strength, and balance. But please remember, the last statement that says is supervised training is recommended over non-supervised training programs. What we do is before starting a physical examination or a go ahead from the doctor, especially if you're 35 years and above, you have type 2 diabetes for over 10 years, you have type 1 for over 15 years. If there is a slightest history of heart disease or you have a heart condition, please get yourself evaluated. If there's a presence of microvascular disease, retinopathy or nephropathy, I'm going to come to those guidelines as well. Get yourself evaluated and presence of PVD. So when I say evaluation, one, it means that you have to go to a consultant. He might tell you to do a certain level of blood check, might ask you to do some form of treadmill test or some 2D echo or something that he needs to be sure, he or she needs to be sure that it is okay for you to start a good level of activity. When I say good, I mean moderate level of activity. But this activity has to be with 5 minutes to 10 minutes of warm up and cool down are a must, irrespective whether you're supervised or you're not supervised training program. You cannot skip your warm up and you cannot skip your cool down. Again, they say that if you stop your exercises 1 or 2 weeks, you're going to diminish all the benefits you've made, all the progress you've made. So try and stick to 5 days a week. You can take a 2-day break in the 7 days. Proper footwear. I'm sure when we come to the next topic, Jankana is going to speak about foot management. So she will, I'm sure we'll talk about footwear and socks, cotton socks to be worn. Because footwear, if you're going to be walking for 30 minutes or 45 minutes, we want your feet to be comfortable. We don't want you to land up with ulcers or any redness or any soreness in your feet causing to another complication. And if you're on insulin, please remember, you cannot inject insulin in the body part that's expected to be used during an exercise. So if you're going to go for a walk, you could do a abdomen and you will not do a lower body. If you're going to go for a swim or where you're going to use your upper body also, then again, you avoid using upper body and you use your abdomen. And very important is please stay hydrated because most of the times we forget to drink water in the normal routine exercise. You definitely tend to. Quickly coming to the recommendations of peripheral neuropathy. If you are doing any repetitive exercise on a feet that is lost sensation, it is going to lead to ulceration and fractures. So please avoid anything that is going to be weight-bearing exercises. So what is the alternative for exercise? Who have peripheral neuropathy? We usually suggest swimming. If you can't go swimming, you have stationary cycles at home, which you could do 10 minutes, take a break, again do 10 minutes and take a break. You could sit on a chair and do upper body and lower body sitting activities, or you could do lying down exercises. All of these can be taught to you by a physiotherapist or a fitness trainer who's certified in handling medical conditions. Again, it still goes, using proper footwear during peripheral neuropathy is most crucial. Monitoring and examining your feet every day after some form of activity is also very, very important. And if there is anything that you notice which is not right on your feet, talk to your doctor immediately. Coming to autonomic neuropathy, there are chances, if there is neuropathy, there is a chance that the person might have an increased risk of cardiovascular risk, or there could be in hypotension after a vigorous activity. And if you're working in extreme conditions, there could lead a lot of issues also leading to dehydration, fainting, falling down. So these things have to be taken care when you're talking or counseling your patients. Of course, with nephropathy, low to moderate, walk, I would say, is the best. Avoid anything that's high intensity and vigorous. And if somebody's on dialysis, let's understand they're anyways undergoing a lot of physical trauma in terms of going through dialysis. So even a walk from one room to another room could be an added activity for them. So you have to be very careful of how you handle patients with nephropathy. Retinopathy, if not taken care, could lead to bleeding in the retina, which we have to avoid. So nothing which is high impactful activities like weightlifting or jogging, running, or high impact aerobics. So we suggest swimming, walking, and stationary cycling. My last slide I just wanted to state is I have come across, there's no offense to anybody here, but I've come across a lot of educators who've never managed to, whatever reasons, have ever used a treadmill or never used or done yoga, or never used dumbbells, never been to a gym. If you've not done it, it's very difficult to counsel. So what I believe is do it yourself first, and then it is easier to handle a patient with any form of activity or any queries that they have. Thank you. And